Okay, hello, my name is Greg Baxter and I'm talking to you from a company called Philip & Son Training Consultants. Today what I'm going to show you is a skill in CPR and use of an automated external defibrillator. So we're going to go through it step by step and how we go about providing CPR, chest compressions, rescue breaths and using an automated external defibrillator. Okay, so the first step we always do is make sure our scene is safe as we enter, so it's safe for us. And we're wearing protective equipment, so our gloves and masks if necessary. So we get down to our patient and we're going to see if the patient is responsive. So to do this we tap, hello, hello, can you hear me? Can you open your eyes please? So if there's no response from my patient, I'm going to get people around me, if there is people around, to phone for an ambulance and see if there's an automated external defibrillator available in the locality. If I'm on my own, then I'm going to have to make this call myself. But with the mobile phones now, we don't have to go and leave our patient anymore. We have our mobile phones, we can make that call ourselves. So the next thing we do is, so in this circumstances, I've sent somebody to go and do it for me. We're going to open the patient's airway. To open their airway, do a very simple little move called a head tilt chin lift maneuver. So you put your hand on the patient's forehead and two fingers under the bony part of the chin, and we open the airway. We do this specifically to stop any blockages that might be there, particularly the tongue. Now, one of the most famous things that we often hear on courses is that you can swallow your tongue. That's not possible. It's anatomically impossible for that to happen. But what can happen is your tongue can slip back and block your airway. So what we do is very simple, just our head tilt chin lift, and it lifts the tongue up off the airway and allows the patient to be able to breathe. So once we've done that, we've opened the airway. We're going to put our ear down to our patient and we're going to watch chest rise. We're going to listen for breath escaping from the mouth and nose, and we're going to see if we can feel breath escaping from the mouth and nose on our cheek. We do this for no less than 5, no more than 10 seconds. So 1, 2, 3, 4, 5. So in this circumstances the patient is not breathing, so I'm going to have to perform chest compressions. So we always start with chest compressions now. So what the first thing I do is I come from under the armpit, find the center of the chest like so, put the heel of my hand down, interlock my other hand like so, keeping these fingers off the chest if at all possible, a 90-degree angle above my patient's arm straight, and I start pushing. So I push at 30 times to a depth of at least 5 centimeters, and I'm doing it at a rate of 100 to 120 compressions in a minute. So that's deep and that's fast. So we begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So I've given my 30 chest compressions. I'm going to show you how to use a face mask. Okay, so this is the best protection if given rescue breath on the patient. As you can see, it goes to the curvature of the patient's face. You pop the mask out. There's a one-way valve on it. There's usually a little point here which shows that it's going to the nose. Don't worry about putting this around the patient. Okay, we put it across the patient's face like so, pushing down, and we do our head tilt chin lift, and we're watching for chest rise here. So I got chest rise there on the second one. The likelihood was I didn't get chest rise on the first because of a poor seal, and that's normally the main reason why we don't get chest rise when it comes to this. But it's only ever 2 breaths, and I'm straight back into my chest compressions. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Back my rescue breaths. Okay, and I keep going between chest compressions and rescue breaths. And then when the AED arrives, we immediately stop chest compressions. So this is an AED, or an automated external defibrillator. We will immediately take out the defib. We'll put the defib between our knee and the patient's head, so we're in good control of the defibrillator. And we turn on the machine.
Hold it up.
Apply pads to patient's bare chest. Plug in pads connector
As
next
you
to
can see,
flashing light.
it's talking to me, it's telling me what I need to do. Okay, So I'm going to make sure the chest is clean. There's nothing on it that can cause problems with putting on the pads, such as perspiration, piercings, pendants, chains, pacemakers, other things like that. And we apply the pads on our patient.
Apply pads to
As you can see here, it tells you exactly where you should put the pads.
Next to flashing light.
So this one goes between the collarbone and the nipple on the patient. So we put on that pad like so.
Pads. Plug in connector.
As you can see in this pad, it goes right under the breastbone. So you literally put it like so on the patient's chest. Plug in my defibrillator.
Analyzing heart rhythm.
Yeah, make sure everybody is staying clear.
Do not touch the patient.
Everybody staying back, please, staying clear.
Shock advised.
Now we'll give a couple more chest compressions.
Charging. Stay clear of the patient.
Tell me stay clear again, so everyone stay back, stay clear,
Deliver
please.
shock now.
Okay, so I'm clear,
Press the
everybody's
orange
clear.
button. Shock
Give
delivered.
the shock, and straight back into my chest compressions.
Start CPR.
And I keep going with CPR now until either the ambulance service arrives and tells me to stop, the patient shows signs of life, or I'm physically unable to continue. In 2 minutes time also the defibrillator will reanalyze the heart rhythm and determine whether there's another shock needed or not. Okay, so in a basic terms, that's how your defibrillator and CPR works. To learn more about CPR and defibrillation, feel free to sign up to one of our CPR and AED courses or one of our first aid courses. Thank you very much for watching.